Depression can show up in different ways, and our brains are incredibly complex structures. In this video, we will be covering 4 forms of depression, but it is important to note that there are many more. If you are worried or just have some questions, speak to a mental health professional or your doctor. The 4 forms of depression are major depression, persistent depressive disorder, chronic major depression, and minor depression. These conditions share many of the same symptoms and treatments, even though they have different names and may affect the body in different ways. Medical terms can be confusing to follow, so we're going to break them down one by one. The first and most common form of depression is called major depressive disorder, or major depression. This is a constant feeling of sadness and a loss of interest in life that lasts longer than 2 weeks. According to the DSM-5, the manual doctors use to diagnose people, if you experience 5 or more of the following symptoms over 2 weeks, you may have major depression. Sadness for most of the day, especially in the morning. Exhaustion. Feelings of guilt or worthlessness. A persistent negative outlook on life. Weight gain or weight loss. Sleeping too much or too little. Difficulty focusing on making decisions. Lack of interest in activities you used to love. And frequent thoughts of death or suicide. The next common form of depression is persistent depressive disorder. This is a less intense but long-lasting form of depression. For example, you may experience a loss of interest in daily activities, but you do not feel at risk for suicide. That's persistent depressive disorder. The next type of depression is chronic major depression. This is like a combination of the last 2 we just talked about, major depression and persistent depressive disorder. When your doctor uses the word chronic to describe an illness, it means that it's been going on for a long time. Chronic major depression is when you have extreme symptoms of depression for 2 years or more, and they interfere with your ability to live your daily life. Last, we have minor depression. This is when you have mild symptoms of depression for 2 weeks or less. You might have ups and downs throughout your days, and this will likely affect how you feel, but also your ability to do tasks and work. Those are the 4 types of depression: major depression, persistent depressive disorder, chronic major depression, and minor depression. While depression is a standalone disorder, it can develop as a result of another medical condition. Depressive disorder due to another medical condition is a diagnosis in itself, and it happens when someone develops depression because of another health issue. Parkinson's disease and multiple sclerosis are 2 of the conditions often linked to depression. Someone's depression may improve or disappear if the underlying condition is treated. Depression has many different phases and degrees of severity. If you notice symptoms of depression in yourself, speak with your doctor. If you feel a loved one is suffering, encourage them to seek support too. There's no shame in depression. It's a common and serious medical condition. The sooner you receive a diagnosis, the sooner you can get the support you need and deserve.